Dr. Charley Cheney, board member of the magazine The New Dentist. Today we're in the Rockford Clinic of West Georgia, located in Temple, Georgia. We will be seeing patients today and using the Physics Forceps for atraumatic extractions. The Physics Forceps comes in a set of 4. We have our lower universal, upper anterior, upper right, and upper left. With the Physics Forceps, you have 3 components of the instrument. The beak, which engages the lingual aspect of the tooth. The bumper, which is placed as deep, as far down on the vestibule as possible. And your handles, which act as the lever using Class 1 lever action. The difference between using conventional forceps and the Physics Forceps is the handling of the handles. You're not grasping the handles, clamping down on the forceps. Instead, you're just engaging it and rotating your wrist. The energy comes from the rotation of the wrist and not clamping down on the forceps. On our first patient, we'll be extracting 6 teeth on the lower arch. So this is preoperatively 21, 22, 23, 28, and 29 that we will be extracting today. I begin by releasing gingiva with a periotome. I will release all the teeth at once, followed by applying the Physics Forceps one at a time. A little sensitive there. Okay, I'll apply a little anesthetic in that area. Myself from clamping down on the forceps, I just use the outsides, or actually the insides of my outer fingers, just to grasp it. And we're going to just rotate the wrist. This is the part where you just have to sit there and wait. Allow the energy to build up in the tooth, and you will see the tooth move. Once the tooth has moved, pick up a universal. It's already moved. We're looking probably for about 1 millimeter. Alright, so it's moved about 1 millimeter. I don't know if you can see. So now we're just going to pick up universal lower and finish extracting the tooth. Buccal bone still preserved. Let's see the forceps again. Applying the beak lingual aspect. Bumper as low in the vestibule as possible. Hand position. And just rotating the wrist. And at this point, just be prepared, be patient. We've got our tooth moving. There we go. One thing I like to do with the forceps is actually have my hand position as low on the handles as possible to maximize the amount of energy that we're delivering to the ligaments. Our lower left side, 3 extractions, feeling buckle plate still intact. All right. So finishing our procedure, we're going to come to the lower right quadrant and extract number 28 and 29. We've already separated the gingiva with the peritome, so we're going to apply the forceps. Again, placing the beak as far apically on the lingual side as possible, and the bumper resting in the vestibule. Alright, go ahead and raise your chin up for me a little bit now. Perfect. Once again, hand position to ensure that I don't clamp down on the forceps, and we're just going to rotate the wrist. Alright, we've already got it releasing. And can you raise your chin up just a little bit more? Perfect, perfect. Alright. So we're going to continue the extraction, universals, just to pick up the tooth. You can see how loose it is. We're just going to deliver buccally.
No, you're fine. No problem.
Go ahead. Alright. Last one. Placing beak apically on the lingual and our bumper in the vestibule. Just going to rotate the wrist. Just waiting for the energy to build up to release the ligaments. And I feel it. All right. All right. We have completed 5 extractions. Lower left, lower right. Everything feels good here. Dude, you've got great bone, man.